The AT Still model for teaching is very interesting, and there's two aspects of it that I really like. One is it gets the students into the clinics very early in the course. They really get involved with the patients very much starting in the second year. The other aspect of the model that's really different than my medical school is so much of my medical school revolved around learning in the hospital setting. So the emphasis on getting the students into the community health centers is that they're actually doing the kind of medicine that we would like them to continue doing when they graduate.
Being a part of this, you know, it was definitely a futuristic idea, you know, that you would have students who would be educated out in the community.
So the thing that the students get out of this model is a true passion for their patients and for patient care. They're embedded very early into clinical settings, but more than that, they're embedded really early into the idea that they are going to approach all of their education from the standpoint of how is the patient presenting? What are the other circumstances in their life? What are the other circumstances in their community? Do they have access to food? Do they have access to shelter? You know, what are the other challenges that they're facing? So when those students then go out into clinical rotations, I get feedback that they are far better historians. They're getting history that that person that's been seeing those patients for a long time may not have known about. So they're getting a very unique perspective of how best to connect with their patients. They're getting a great clinical skill set, and they're also getting a public health perspective that I don't think is taught at many other medical schools right now.
If they've got strong foundations for those things, they can go out and treat patients who really need the most care, which is our underserved populations, really do require somebody who can deliver not only high quality care, whole person care, but compassionate care.
All of those small parts are going to summate into a really huge impact, I think, on U.S. healthcare and the lives of our patients, which is what matters most.